Hello everyone, my name is Adam and I'm one of the audiologists at Alto Hearing, and I'm back today to bring you another earwax removal video directly from our clinic in Lutterworth, UK. If you enjoy our videos, then please do like the video and subscribe to the channel. It really makes a massive difference and we really appreciate it. So this is another one of Maria's videos today, and she had a really interesting one, as often you can look at earwax removal videos and think it's just earwax in an ear and we're taking it out nice and easy, but everyone has their own story attached, and it's really interesting to hear how people came to the conclusion they needed to go and get this wax removed professionally. Sometimes it's just they couldn't hear or felt blocked up, but for this person it was because they're in a large choir. A really popular one actually, that sing all over the country, and they have noticed that they really weren't hearing as well as they normally do. So it was pretty important we got this lady back to hearing well again, and actually she was quite worried when she came in and hoping it was earwax rather than permanent damage to their hearing. So she was definitely relieved when we took a look in and said, yep, there's a blockage in there and that needs to come out. You can see it's quite deep as well, and there's a bit of skin we just tidy up in there. You have to be super careful when doing this as it's a delicate area. The other ear was actually a little bit more challenging as the wax in here was quite dry, so Mariia tries to get it out initially with suction, but we did have to throw in a bit of sodium bicarbonate drops in there just to try and lift it away from the ear canal a little bit. This seemed to make a difference, but this wax is sitting very deep, and so you just have to be really patient, small movements, just lifting it up around the edge before you can get enough to grab onto. And that's what Maria's doing here, just tiny movements, always talking to the lady, making sure she's comfortable. That feedback between the clinician and the person having wax taken out, it's just so important. We're always trying to gauge how people are, which can be quite hard to do when you've got two hands in use and you're looking down at a camera. So we often go off subtle cues and talking to them all the time. It's really easy to watch these videos and go, well, why didn't you just do this or do that? But unfortunately, there's a lot of context missing that you can only get when you're in the room with that person and making a clinical judgment. This stuff was quite gristly, so it's tricky, and we don't just want to get the forceps in straight away and pull it out just yet, as we want to see a bit more movement to ensure it's not still stuck to the canal wall too much. It's a hard one to judge, but the skin in that part of the ear is so thin, and when it's a bit dry and wax is almost fused to it, it can be painful and cause abrasions, which increase the risk of infections, so we want to avoid that by any means possible. Once we put a little bit more of the drops in, we leave it for a few minutes. I think this again is sodium bicarbonate, which does tend to help lift wax off. Sometimes it can dry out the ear canal a little bit, and we might recommend something like Ear Calm afterwards to help with the dryness. But after we put this in and leave it for a few minutes, it's there we started to see a little bit more of that movement we want, and then you can get the crocodile forceps in and just lift the rest out, although it is easier than it looks for sure. A little bit more dry skin followed at the end, but in the end we just decided to leave it as it was a bit painful for her and we had a good view of the eardrum anyway. The lady was able to hear again, absolutely thrilled as you can imagine, another happy customer. So that's it for today. If you do enjoy these videos, please do give us a like and subscribe to our channel. We look forward to seeing you again very soon. Take care.